Good afternoon, class. My name is Daniel Alanis, and today I'll be giving you a presentation on how extended reality technology is being used to improve healthcare education. So as you can see here, by this beautiful visual, it's exactly what you think it is. It's the headsets that we use for entertainment. So this is another visual of a medical student who's using a technology for Precision OS. I'm sure many of you and your kids use this technology to play video games, but this has actually been adapted to help clinicians learn how to practice skills, collaborate in an immersive environment. For example, my first real life code situation. Nothing in school, in clinicals, nothing could have prepared me for what that situation was and what I had to do to resuscitate a person who was dying. If I had this technology where I could put this headset on and hear the sounds, have all the people in the room that were in the room, have a patient who was physically dying in front of me, I would have been better equipped to handle that situation the first time that it happened to me. So that is the level of realness and realism that this technology is now providing clinicians. For a surgeon, right? Imagine doing a very, very high risk procedure that you've never done before, and the patient's life is on the line. And now imagine that you are able to do that and practice that procedure 20 times at a very, very real level with no risk at all to anyone's life, right? That surgeon is going to be 20 times more confident going into that life-saving procedure. So benefits and applications, obviously it's going to enhance your learning, right, to a whole new level. For example, when I was learning how to start an IV in nursing school, I had a plastic arm and a needle, and they just told us to continually practice inserting that needle into this plastic arm. I had no real feedback of if I was doing it right, not right, and then I get into a room and I'm starting an IV on a patient for the first time, and it's completely different than using a plastic arm. So this technology is giving you that, can give you that live feedback. For example, if you hit the vein right, you get blood return, and you can actually see that in this technology. The patient might move, right? And then that might adjust the angle, or you have to reinsert the IV to be able to get it. You can't get any of those high level details in the training today. So it's going to improve people's training, right? So going back to the code situation, in nursing school, we did code simulations with a mannequin with my other nursing students who also had no idea what it meant to code a patient. But for this technology, you can get every single role simulated in that VR. You can have a couple doctors with doctor knowledge, right, performing in their role in that virtual simulation, multiple nurses, maybe some techs, maybe a paramedic who's bringing the patient in and giving a report. All those things were missing from a real life standpoint in my training. And then finally, that practicality is going to translate into higher level of care for the patient, better care for the patient, because your clinicians are going to be more prepared to go in and hit the ground running. So some examples of real organizations who have already implemented this technology are Massachusetts General Hospital. They have purchased the Precision OS VR system for their orthopedic education, and that allows students to practice doing these high-level surgical procedures. As you can see on the left, she's doing a spinal procedure. The attending doctor is able to give her feedback as she's doing the procedure, right? No one's spine is actually at risk here. No one's at risk for being paralyzed if this student does something wrong, but she's gonna walk away from this with more skills to perform that procedure. At Johns Hopkins, they utilize VR training for resuscitation and acute care management. So they are really big on having multiple people use these headsets all together, and they are going through these simulations at one time, collaborating and building that unit cohesion, that team cohesion that's going to translate to at the bedside when somebody's life is at stake. So who can benefit from this? Everyone who's a learner, right? We all start somewhere. We all start at the student level. So healthcare students can start using this technology. Paramedics, providers, and residents, any nursing practitioners from bedside to all the way to provider level. But ultimately, the patient is the one who benefits from this technology for all the reasons that we've talked about here, in just enhancing the quality of care from the very beginning of people's experience, and clinicians build on that experience even more. Finally, evaluation summary. The pros I won't go through because pretty much we've spent the entire presentation talking about the pros. The only major two cons that we could think of are the cost. Obviously, these headsets aren't cheap, right? You can go to Best Buy and buy one for entertainment, and I think it's like $1,000 a pop. To implement the sort of technology that healthcare providers would need, you're looking at a very significant upcharge for that. So thousands of dollars to invest in, but you're investing in the patients, you're investing in your clinicians who are going to be taking care of your community. And then finally, the technology aptitude. You have a new generation of healthcare students who grew up with this sort of technology. They grew up with iPhones in their hands. And it's going to be very easy for them to just step into the classroom and put on that headset and know exactly what to do. But imagine your older generation who don't necessarily have the aptitude to be able to use the technology the way it's intended. Therefore, they can't bear that fruit of the learning and the practicality. So you have to find a way to bridge that gap, right? Obviously, very extensive training program on how to utilize the technology, but that's not something that is going to be a showstopper or something that would prevent you from moving forward with using this sort of thing. So that concludes my presentation on extended reality and healthcare education. Hope you enjoyed it, and please let me know if you have any questions. Thank you.